Dr. Olayemi Dawodu is a pathologist and director, Cleaner Lancet Laboratories. He joins us now for more on this development. This year's World Health Day has the theme Building a Fairer, Healthier World. Talk to us about your experience with healthcare inequalities in Nigeria and how you think the pandemic has drastically affected it.
Good evening, and thank you for the question. The gentleman, the medical director said earlier, we already had a very strained and fragile healthcare system before the pandemic, which was worsened by the pandemic or made more glaring in terms of access to health care. In my experience, I believe that we need to work on revamping the primary healthcare system, because that is the arm of healthcare delivery that is closer to the community. If you take into consideration that we have about 30,000 primary healthcare centers in the 774 local government areas, which means you have between 30 to 40 primary healthcare centers. And if we also look at the population of Nigeria, we can also see that over 50% of our population live in the rural area. So when we're talking about equality and fairness for a healthier world, if we're able to revamp our primary healthcare system, which I must say the government cannot do alone. In some states, we have public-private partnerships that have taken over. You have about 79% of these primary healthcare centers being public. Now, if we're able to turn around and take in more private organizations, to take them up, to bring them up to par in terms of their infrastructure and the equipment that are there, to also train and incentivize personnel to stay in these areas, I think we'll be able to reach out to cover more of the population.
What do you think is responsible for the delay in having all of this done? Because this is not the first time we're talking about the need to revamp the primary health care centers in Nigeria. Is it a political will that is missing, or we just do not have the capacity to make it happen?
So I still think a lot of work needs to be done in terms of the enabling environment by the government. Yes, I know it's not the first time that we've spoken about PPPs, but I think there has to be some political will as well to drive policies that will put the enabling environment in place for these things to take off as well. And pivotal to this, apart from when we talk about revamping, central to all this is healthcare financing. I mean, we haven't gotten to the recommendation that was given by the WHO when we're talking about universal healthcare coverage, to have 15% of our budget earmarked for that. Apart from that, in terms of funding, the health insurance scheme is not yet well coordinated in terms of synergizing the formal and informal insurance system to be able to cover the population. What we have is, up to almost 80% of people accessing health out of pocket. And this, when you put it in context with the fact that we have a high population of people that are living in extreme poverty, we have a lot of work to do in terms of sorting out the healthcare system, because it's really a complex problem. I also think another thing in terms of planning that we need to look at, yes, we have limited funds to deploy. However, we must also work with data. I think that data collection and getting the health information system also synergized, getting unique identifiers for people, for us to be able to arrive at what our prevalent problems are. We will not be able to solve all the problems, but if we're able to identify what the important problems we have are, then we are able to triage them or prioritize them and start to deal with them.
I hope someone who has the responsibility for change is listening to all of this. Pathologist, Managing Director, Cleaner Lancet Laboratories, Dr. Olayemi Dawodu, thank you for talking to us tonight.
Thank you very much.